Hi guys, in this video we are going to show you how to do a perineal prep with betadine scrub and paint. You may also be asked to do a perineal prep using HIPAA. If you are, you can use the HIPAA in the same fashion as you would the betadine scrub and paint. So just be mindful the process of applying the HIPAA is the same as doing it with the betadine scrub and paint. This prep can be very messy, so please make sure that you put something underneath the patient's bottom when you do this. You also want to put some sort of bag underneath the patient in order to collect urine, because you usually are asked to do some sort of straight cath. So you can put either a garbage bag right underneath the patient's bottom like this is right here, or you can also put a garbage can to collect the urine as well. All right, I have already opened my set here with my betadine scrub and paint. So I have my sterile towels and then my black towels, and then I also have my betadine scrub and paint. When you open this up, you have your scrub and your paint. The paint is always green and the scrub is always brown. When I do this, I always put my paint with my paint sticks, and I always put my scrub in the empty slot here. I do it that way because when you open the solutions, they look identical and it's really hard to differentiate them. So I always put them in the exact same spot every single time, so that way I don't get myself confused. So I'm going to open my paint and I'm going to put them with my paint sticks. I'm going to open my scrub and pour that in my empty slot here. All right, because this is betadine scrub and paint, I know that I'm going to start with my scrub solution first. So the first thing that I want to do is put my white towel underneath the patient's bottom. So I'm going to step away from my sterile field. I'm going to open this up. I'm going to protect my hands, and I'm going to put that underneath the patient's bottom. First thing I'm going to do is grab one of my sponges. It butterflies like this. I'm going to get my scrub solution, and I'm going to start at the top of the patient here. So this is a scrub, so you are going to use small circles. You're going to start off at the top of the patient, and you're going to scrub. You're going to come down, and you can stop here, and then this gets thrown out. I'm going to grab my next sponge. I'm going to start at the other side. I'm going to come down the patient, and I'm going to stop here. If you notice, when I applied that, I did not go on the inner labia. The reason why I didn't do that is because the scrub can be really caustic and it can cause burns. So I do not want to go inside the patient with that. The other thing that I did not do is go from out to in, out to in. The reason why is because my surgical site is the vagina. I do not want to go out and bring things back in. I want to take what is my surgical site and move things away from it. So that is why I did not go out, back in, out, back in. All right, I'm gonna grab my next sponge, and now I'm gonna start where I left off, and I am gonna work on a leg. So I'm gonna start at the top, and I'm gonna scrub, and again, I'm moving away from my surgical site. I'm going to throw this sponge away. I'm going to grab one more sponge, and I'm going to do the exact same as I did with my other sponge on the next leg. I'm going to start where I left off. And I'm going to work out. Again, I'm taking whatever was in the middle and I'm going to push it away from my surgical site. I'm going to take my first blot towel, step away from my field, open it up, walk up to my patient, and I'm going to blot. So I'm pushing those molecules into the patient's skin, and then I'm going to pull from the top, and I'm going to pull the dead away. I throw that in the trash. Next thing I'm going to do is grab my paint sticks. So this is a paint, so I'm going to paint it on the patient's skin. I grab my first paint stick, And I start off at the top, and I like to keep it flat to start off with. For me, that's a little easier. So I start off flat, I come down, and I stop before I get to rectum. I go to the other side, and I stop. I take my fingers and I spread her open, and I do inner labia, and then I go inside her until I hit cervix, and I twist on the cervix. I come back out of the vagina, and I go down rectum, and then I throw that out. I grab my next one. I get that nice sloppy wet on both sides. I'm going to start where I left off here, and I go down one leg, all the way down as far as you can without hitting the drape. Then I take it and I flip it over, and I'm going to use this side, and I'm going to do the other leg. Now I'm done with this. I throw this one out. I grab my last sponge stick, and I do exactly what I did with the first. I start off at the top. I come down, stop, open her up, inner labia, go inside, twisty, twisty, twisty. Come out, go down rectum, throw this out. And then I can grab my straight cath or grab my Foley, anything that I need to do, I insert that. And then I can take my hands off, and the surgeon can then drape the patient.